Matthew Holt, another THCB Quick Bite. This is Jeff Gartland. He is the CEO of Relatient, which does something with relating to patients, I would guess.
It does.
Okay. Jeff,
Yes.
tell me a bit more. You're in the world of customer experience, health plans. Tell me more.
Yeah, more broadly, we're really around intelligent scheduling. So our goal is to really allow for a balance between a great patient experience, a great consumer experience, but also really enabling providers, in particular, larger ambulatory specialty providers, to bring in a great consumer, but also ensure that they've got fantastic downstream staff and provider workflows. So it's the intelligence of the rules, the preferences, the dynamics that really mean something day in, day out for providers, but surfacing that up in a way that's a great consumer experience.
All right, so there are sort of two problems here, right? One is figuring out how you get access to how the consumer gets to the provider system.
Yep.
And the second one is all the back-end stuff that's scheduling, which is really, really hard.
Yeah.
So tell me about both of those.
Yeah, so the front half, find a provider. A lot of that has to do with how do you enable it into Google reviews, how do you enable it into search engines, how do you drive activity to it, but also ultimately, when you're trying to find a provider, who is the right provider for the ailment that I particularly have? And so where we fit into that equation is not just the basic searching of a provider, the listing of a provider, though we have that. It really comes down to who is the right provider for me around convenience, specialty, the subspecialty and the depth underneath it is a big piece on that front end. The secondary piece of yours is really where our secret sauce is. And so it is all of the nuances of a given practice, locations, who practices where, which given days, who's the best subspecialist, where do you have capacity, where do you have a new provider that's building a panel, where do you have a provider that has a full panel, and how do you balance that load across a larger, more complex ecosystem. So that's a really important piece of our value proposition.
So we hear a lot about leakage, we hear a lot about systems that don't have the right front door, don't have the right approach. There's also the issue of who's really choosing, right? Are you the provider? Are you the consumer choosing? Is the provider choosing? Is the health plan influencing that? Give me a sort of hover up a few thousand feet and tell me, how is this kind of playing out? Who's winning and losing? Who's making the choices? Who is the most important person in decision making? When you show up, who you having to influence?
Well, it's a really dynamic space, so I appreciate you raising that. I don't think healthcare has a front door. It's got side doors, trap doors, revolving doors.
Right.
It's got all the different kinds of entrances and exit ramps that you can possibly imagine. With that comes a lot of complexity, which I think you're hitting on.
Yeah.
One thing that we see that is really materializing is that more and more the experience that a consumer has in the basics of finding a provider, scheduling myself, the convenience factors that go into it, it is having an increasing amount of weight in terms of how they view that experience with the provider as a whole, even in comparison to the clinical quality. And so what we're really focusing in on is how do we ensure that we enable providers with a great experience for their consumers so that their clinical experience can also shine as well.
So there are a number of other people playing in the space of sort of scheduling, putting people who've been around a while, the kinds and others in the world. What's your sort of special sauce? What's different about Relatient?
Yeah, so a lot of other players, I think, treated scheduling as the secondary effort in terms of doing different aspects around patient engagement. Sometimes it's marketing, sometimes it's around provider data management, other different angles, intake, registration, so on and so forth. We really started in the construct of scheduling itself. So our focus is on intelligent scheduling, and those other capabilities are really features that wrap around it. And that's a key element to it. For us, I think we found our sweet spot in larger provider specialty groups where they're not dealing with the large acute system kind of challenges, though we have many large acute providers. Our focus is really around how do we enable those clinics to be the best clinics that they are, and those physicians to be the best physicians that they are, and not worry so much about all of the back end system that goes into scheduling the right patient with the right provider at the right time.
All right, give me some numbers. How many clinicians on the system, how many systems on the system, as it were, and how many patients are using you?
Yeah, so patients, we touch 50 million unique patients a year, so very large swath of patients. About 4,000 customers total. When you kind of look at that, providers were around 45,000 providers total.
So these are big numbers. I mean, there are millions of providers in the country, but still a healthy sort. Tell me a bit about the company. How long's it been going? How much money you raised? How many people you got? Where are you in the whole life cycle?
Startup
thing we hear so much about.
We are not the startup anymore. We actually merged about two and a half years ago, which is when I joined the company. We brought two companies together, Relatient and a company called Radix Health. Both of those were about 7 or 8 years old individually. When you put two companies together, 7 and 7 doesn't equal 14. So we obviously had to go through integration and really making those value propositions and the technology work together well. And we're through that phase of it now, and just growing like wildfire.
How much money's gone in so far?
Well, enough.
People are getting very cracky. 2 years ago, we say, I've raised $287 million from SoftBank, and now it's like, enough. North of this, or that, all right.
I will say this. We've spent an inordinate amount of time and energy and effort, not just money-wise, but really from a people and process perspective, getting this business into a really stable and growing fashion, and we're super excited about that because we're at a stage now where we have the agility and the flexibility to really target the market and grow as we want to.
Fantastic. Speaking of Jeff Gartland, he is the CEO of Relatient. Thanks for your time, Jeff.
Thank you.